I'm now pleased to introduce our next speaker, Dr. Antwi Akom. Dr. Akom has been named a 21st Century Eco-Visionary. He's currently founding director of the Social Innovation and Urban Opportunity Lab, abbreviated SOUL, S-O-U-L, the first digital health research lab between the University of California, UCSF Medical School, and San Francisco State University, which combines urban planning, population health, and human-centered design. Dr. Akom is also co-founder and CEO of Streetwise, spelled W-Y-Z-E, which has been named by the Atlantic City Lab and PolicyLink as one of the most innovative technological platforms to collect real-time data on health and buildings and transform the social determinants of health for our nation's most vulnerable population. I understand Dr. Akom will be coming to us by teleconference or video, and he'll be speaking, among other things, about the new Scholars Program. Dr. Akom, and I hope we can cue that up. Thank you very, very much.
Thank you so much. I want to thank all of the people up on the screen who have created this opportunity for me to speak to all of you. You all have done an amazing job and are at the forefront of the healthy building revolution. And thank you so much for having me. I want to say to the scholars, you all are the next generation leaders, connecting the relationship between the built environment and human health. And in this way, you all are really the future of the health and buildings movement. And I want to say congratulations to all of you. I've come here today to talk to all of you about designing health and buildings with our nation's most vulnerable populations. And how can we transform healthy buildings into healthy spaces and places for all races with real-time data and sensing technology. In that sense, I've really come here today to talk to all of you about movement building. In the healthy buildings movement, we mostly talk about healthy buildings for the 1%, but not enough about the 100%. We have the U.S. Green Building Council, we have GBCI, we have STAR communities, Green Star, Eco Districts, the Well Building Institute, and all of you are very familiar with all of these. But there are a whole lot of people and places and spaces that don't know what these acronyms mean, who these people and places are, and these are often the people, the places, the spaces, and the races that take the brunt of the impacts when we have natural disasters like droughts and heat waves, or when we talk about two of the most pressing issues of our lifetime, that is climate change and income inequality. And I want to tell you all a really quick story about how I personally got involved in the healthy building movement. I grew up in a single-parent household headed by the most loving, caring, nurturing woman in the world. So I'm sorry to all of you, but I won the mommy jackpot. But we were poor, and my mom got lupus, and we had to declare bankruptcy. And the only way that we were able to struggle and survive, the only way that we were able to make ends meet, was to get connected to food and finances and housing and cars through friends and family and social networks. And I want to be really clear what I'm sharing with all of you. I'm saying that Black people, indigenous people, poor people, women, people of color, we invented the sharing economy. But when the sharing economy gets commercialized, when it gets commodified, when it gets corporatized, we all know that where the ghetto, the slum, the favela, the barrio, the res begin is where bike share and car share and greenways and the healthy building movement too often ends, and we collectively need to do something about this. And that's why all of you are here. And I start here because the fastest growing cities in the world no longer look like New York or London or Tokyo or Singapore, but rather they're ghettos, slums, and favelas. They're informal settlements, and that's where our future design teams and architects and planners and engineers are going to be coming from. And my experience growing up was probably like a lot of you in this room who were part of the first wave of the healthy building movement that failed. The first wave healthy building movement failed because we put affordable housing in the middle of food deserts, surrounded by liquor stores and fast food restaurants and abandoned buildings and toxic air, where there were more drive-throughs than drive-bys, and where every day people were dying of curable diseases. For example, where I now work in Oakland, West Oakland, the childhood obesity rate is 5 times that of Piedmont, which is only 2 miles away. The problem with the first wave healthy building movement is that it failed to see sustainable buildings in the context of distressed housing, and distressed housing in the context of distressed neighborhoods, and distressed neighborhoods in the context of the social determinants of health, which says a person's life chances, their command over resources, is linked to their access to opportunity. Now, there are 3.9 million children who've grown up in neighborhoods of concentrated poverty like I did. That's 2.5 times the size of Manhattan. And in wealthier countries, there's 30 million children worldwide growing up in this situation. And let me be clear what I'm saying. I'm saying no matter how hard these young people work to get ahead, no matter how hard their parents and relatives and families work to help them get where they're going and to help them reach their full potential, the single greatest determinant of their life chances, of their command over resources, of their access to opportunity is their zip code. And we have this phrase, born in the wrong zip code, but your zip code shouldn't determine building-related illness as well as your health outcomes, although it does now. And this idea that you're born in the wrong zip code, we need to stop using that phraseology, because what does it say about the people who actually live in that zip code? So we have to change this phrase to an asset-based approach. Now, this is a crisis. It's a moral crisis because nobody should be able to tell you before, when they first meet you in your neighborhood, how long you're going to live, when you're going to die, if you're going to fail, if you're going to succeed based on your zip code. But we can do that. And it's a financial crisis because right now we're spending $1.63 billion on the prison industrial complex instead of upstream solutions like building more sustainable, more thriving, more resilient cities and communities. The second wave of the healthy building movement was better in some ways because it was not just about tearing down buildings, it was about tearing down ossified social policies. And in this way, Hope 6 was successful. It revitalized communities, it created jobs, it reduced crime, it increased property values. But the second wave of the healthy building movement also had blind spots. And one of those blind spots is that it didn't clearly see the ways in which the built environment is a reflection of our cultural values. So you all in this room today, NIH, the U.S. Green Building Council, WELL, GBTI, Eco-Districts, all of you are building on the success and the failures of these past waves, and you all are a part of this new third wave healthy building movement. However, I'm here to tell you today that the third wave of the healthy building movement will not be successful without authentic and meaningful community engagement, without designers and architects and planners and engineering with people and by the people, and without community-driven data to transform neighborhoods into thriving spaces of health and well-being. So the real challenge then of the 21st century for all of us in this room today is how do we reimagine and redesign healthy buildings for vulnerable populations that have been locked out of sustainability conversations, shareable city conversations, smart city conversations, and social justice conversations? Will we design healthy buildings for rich people or for poor people? For people of color or for white folks? For eco-haves or eco-have-nots? And who will have a say in how we redesign our healthy buildings both now and in the future? Powerful elites or everyday people? If you want to create a healthy building movement, not for the 1%, but with the 100%, it's not enough to ask these questions that we often ask. How can we build healthier buildings? How can we build happier buildings? How can we build greener and more sustainable buildings? Those are all important questions. But first, you have to talk about the real structural inequalities in terms of race, class, gender, immigration status, poverty, and other forms of social inequality, and unpack the role that they've played in shaping our cities, past, present, and future. So to me, we have not correctly identified the problem. The CDC, HUD, the EPA, the Robert Wood Johnson Foundation, county rankings, Green Star, hospitals, and big data providers on the left-hand side, depending on where you sit at the table, have done a brilliant job or an okay job or a lousy job, depending on where you sit, of setting top-down ambitious goals for the design of the built environment. And I refer to that as the hardware. But what about you all's lived experience in the communities in which we're serving? Your lived experience on the ground, what you know about and care about every day. I refer to that as the software. And the real challenge of the 21st century health and built environment data revolution is how do you bridge this gap between the hardware, which is secondary data, and an official knowledge, and the software, which is primary data and local knowledge, in ways that make data more authentic and meaningful, valid and reliable from the perspective of everyday people. And our way of doing this, we think the real missing link is equity, or what I refer to as people-powered placemaking, which is real-time, two-way communication with everyday people so they can participate in the design solutions that meet their own local needs. So we've built Streetwise, which is a real-time data performance-based platform for measuring, certifying, and monitoring features of the built environment that impact human health. And this is how it works. Streetwise lifts up the power of local knowledge. And what it is it's a mobile mapping and SMS platform that collects real-time information about how people are experiencing cities and services and turns those into actionable analytics. For example, right now, we might have good ArcGIS or geospatial data that Michelle lives near a park. And that's great information to have. It's great proximal data. But what we're really missing is what is Michelle's experience in that park? Is that the park where the drugs are sold? Is it safe enough for Michelle to bring her children to the park? Do the swing sets even work at the park? And Streetwise allows you to collect both proximal data and experiential data, and you can toggle between the two as you wish. And in doing so, we address these two key questions below of how do you democratize data and how do you democratize decision-making. Streetwise tells you things that are happening in the neighborhood beneath the regulatory radar. For example, how walkable is my neighborhood? Right now, we might use WalkScore to tell us how walkable our neighborhood is, but WalkScore doesn't differentiate between different kinds of amenities like liquor stores and corner stores. So you could be living in a food swamp or a food desert but have a very high WalkScore. Streetwise answers and gives us a 360-degree view of what's happening in neighborhoods beneath the regulatory radar. And what you're looking at right now is an example of Streetwise in action. This is a data set from the Alameda County Department of Public Health, where the number of purple dots represent the number of grocery stores in East Oakland. And as you all can see, East Oakland looks like a veritable food oasis. But when you ground truth this information with Streetwise, you find out that those aren't actually grocery stores. They're liquor stores or corner stores, and only a handful are really grocery stores. And on Streetwise, you can upload pictures and audio and video, which is really important if we're working with low or lower literacy populations. So right now, we're about to play a video for you of a young woman narrating the food environment in her neighborhood before I close out this conversation with all of you. Please play the video.
Okay, so what are you looking at? How was it when you went inside?
It was dirty when I went inside, and I would never eat anything in there.
Do you consider this to be a grocery store?
Hell no.
Why?
Because they don't sell any groceries, and it's just a bunch of junk food in there. And I mean, they have little sandwiches, but I would never eat that because it's dirty. And then all the fruit is all wrinkly and looks old. And then all the meat that they did have, like the bacon and all that in the little thing, looks like it's been sitting in there for about a year or something like that. I wouldn't call it a grocery store at all. So, hell no, I wouldn't eat there.
So right away, you can get a sense of the food environment of East Oakland, even if you've never been there. And Streetwise also measures key performance indicators. In terms of our success, we partnered with Google and Aclima this past summer around air quality, where on top of Google Street View cars, we were able to put air quality sensors and collect data on black carbon, NOx, and OX as the Google Street View cars went through neighborhoods. But when they found a black carbon hotspot, the car's moving too fast, so they asked Streetwise if we could ground truth that data with our people sensing platform and then upload it back into their environmental intelligence big data so that we could have more valid and reliable data. We've also partnered with Blue Cross and Blue Shield about using Streetwise to find populations' unmet basic social needs. In Oakland, we're mapping the geography of homelessness. And this past December, we actually, Enterprise Community Partners, the largest nonprofit affordable housing provider in the country, launched an opportunity index on housing powered in part by Streetwise. Streetwise is providing real-time data on housing and helping to build a community engagement and partnership toolkit. These are some of our successes that Streetwise has had across the country. We've launched across the country, and actually we recently launched in New Zealand with the Maori population, and we're doing other work with First Nation populations. The secret to our success. Brian Stevenson taught me that ultimately we will not be judged by our technology, our design, our intellect, our reason. You judge a society not by how you treat the rich, the powerful, and the privileged, but how we embody empathy and compassion and how we treat the poor, the condemned, and the most vulnerable. Because it is in that nexus that we begin to understand our collective humanity, who we are as a people, and our purpose on the planet. I came here today because I believe that the moral arc of the universe is long and bends towards justice, but only if we embody justice in our minds, our hearts, our bodies, and daily actions. That way, that's the only way we can fully evolve as human beings and start seeing healthy buildings as a human right in a way that restores the dignity, humanity, and access to institutional resources for vulnerable populations. If we do all of this, we'll regain the lost art of placemaking and transforming the healthy buildings movement from a movement that serves some of us to a movement that serves all of us. Please join us in building a new community-driven, healthy building revolution that integrates the power of local knowledge and official knowledge that helps make the built environment more affordable, accessible, transparent, open, connected, smart, shareable, and equitable for all. Thank you so much for your time today. I'm sorry I couldn't be there in person. I just had a new baby, which is really